What are hemorrhoids? Hemorrhoids, also called piles, are enlarged veins in your rectum and anus. For some, they don't cause symptoms. But for others, they can lead to itching, burning, bleeding, and discomfort, especially when sitting down. There are two types of hemorrhoids. Internal hemorrhoids develop in your rectum. External hemorrhoids develop around the anal opening, beneath the skin. Both external and internal hemorrhoids can become thrombosed hemorrhoids. This means that a blood clot forms inside the vein. Thrombosed hemorrhoids aren't dangerous, but they can cause severe pain and inflammation. If it becomes too full of blood, a hemorrhoid can burst. What happens when a hemorrhoid bursts? When a thrombosed hemorrhoid becomes too full of blood, it can burst. This can lead to a brief period of bleeding. Keep in mind that a thrombosed hemorrhoid will usually be very painful before it actually bursts. Once it bursts, you'll likely feel an instant sense of relief due to the release of extra pressure from built-up blood. If you have some bleeding but continue to also have pain or discomfort, you likely just have a bleeding hemorrhoid, rather than a burst hemorrhoid. How long will the bleeding last? Bleeding from a burst hemorrhoid can last anywhere from a few seconds to several minutes. However, it shouldn't last for more than 10 minutes. In some cases, the area may continue to bleed occasionally between bowel movements. External hemorrhoids can be very painful if they become thrombosed. Thrombosed hemorrhoids are usually purple-blue. Thrombosed hemorrhoid occurs when the veins that cause the bulge in the hemorrhoid develop a blood clot. As a result, blood is unable to flow to the hemorrhoid, and the effect can be extremely painful. The body will often absorb the blood clot, therefore reducing the symptoms and easing the pain. When the blood clot passes or the body reabsorbs it, an external hemorrhoid may sometimes leave behind a perianal skin tag. What should I do if a hemorrhoid bursts? A burst hemorrhoid usually doesn't require any treatment. But you may want to take a sitz bath to soothe the area and keep it clean while it heals. A sitz bath can also help to increase blood flow to the area, which aids the healing process. To take a sitz bath, follow these steps. Fill a clean bathtub with 3 to 4 inches of warm water. Make sure it's not too hot. Soak the area for 15 to 20 minutes. Try bending your knees or putting your legs over the edge of the tub to make sure the area is submerged. Gently pat dry the area with a clean towel, making sure you don't rub or scrub. Over the next week, try to keep the area clean and dry. While a shower or bath should be enough, you can also take a daily sitz bath. According to Harvard Health, taking a warm bath for 20 minutes after every bowel movement will be most effective. Adding up some salts to the bath can provide further relief by reducing pain. Should I see a doctor? Hemorrhoids are typically easy to treat and clear up on their own. In very rare cases, a hemorrhoid could cause complications. Many people are embarrassed to go to their doctor about their hemorrhoid problems, which is probably why only an estimated 4% of people see the doctor, even if 75% of us experience enlarged hemorrhoids at some point in time. Getting a medical exam will help your doctor recommend an effective treatment, and will also help to rule out more serious causes for your symptoms. Any anal bleeding should be properly evaluated. If you have anal bleeding that lasts for more than 10 minutes, it's best to see a doctor to make sure that something else isn't causing your bleeding. Not all bleeding is due to hemorrhoids, so it's important to not self-diagnose. Sometimes, bleeding can be a symptom of a more serious underlying condition, such as colorectal or anal cancer. Make sure to tell them if you have any of the following symptoms in addition to bleeding: changes in stool consistency or color, changes in bowel movement habits, anal pain, weight loss, nausea or vomiting, fever, dizziness, lightheadedness, abdominal pain. Remember, an irritated hemorrhoid can also cause intermittent bleeding over a longer period of time. Many people are embarrassed to go to their doctor about their hemorrhoid problems, which is probably why only an estimated 4% of people see the doctor, even if 75% of us experience enlarged hemorrhoids at some point in time. Getting a medical exam will help your doctor recommend an effective treatment, and will also help to rule out more serious causes for your symptoms. If you seem to have enlarged hemorrhoids, the doctor will probably recommend a proctoscopy. During a proctoscopy, a short tube with light and a lens will be used to examine the membranes lining your rectum. This will let your doctor see the enlarged hemorrhoids and determine their size. Again, this procedure is usually painless. How are bleeding hemorrhoids treated? A bleeding hemorrhoid is usually a sign of irritation or damage to the wall of the hemorrhoid. This should resolve on its own over time, but there are several things you can do at home to speed up the process and soothe any discomfort. However, if there is no clear source of bleeding or if the bleeding doesn't go away within a week, see your doctor. Experts note that hemorrhoids are often self-diagnosed, which can be dangerous. Many medical conditions, including cancer and inflammatory bowel disease, IBD, can have similar symptoms. It's important to receive a proper diagnosis from your doctor. The best way to prevent hemorrhoids is to keep your stools soft so they are easy to pass and don't require straining. Eating a high-fiber diet and drinking plenty of fluids, 6 to 8 glasses each day, can help you stay regular and keep your stools soft, and may reduce constipation and the need to strain on the toilet, lowering your risk of developing new hemorrhoids. What's the outlook? The blood from a burst hemorrhoid can look alarming, but it's usually not serious. However, a hemorrhoid that is filled with blood will be extremely painful leading up to when it bursts. This pain is severe enough that most people seek treatment before the hemorrhoid has a chance to burst. If you didn't have any unusual pain leading up to the bleeding, you may have just irritated and inflamed hemorrhoid. If you suffer from hemorrhoids, and you tried everything, let me tell you a quick story about my friend Lisa, who suffered from severe hemorrhoids along with constipation and IBS. She was a very bright mid-20s woman yet unemployed because of her condition. She was practically living on drugs, creams and over-the-counters and was at one point in dire need of reassurance and help. I changed her name for privacy. Lisa was treated by 4 different doctors who advised her to keep taking the drugs and apply the prescribed creams. She had followed this 5-step plan with some restrictions and limitations. She learned how to reverse her condition by following the same approach you're about to learn. Lisa committed herself to following the program. In less than 2 weeks, Lisa's hemorrhoids had disappeared along with the IBS and constipation. For Lisa, it was a life-changing experience. This program is a proven system for men and women around the world. Everything Lisa learned and discovered from this research and program is immediately available to you through this 5-step Hemorrhoid No More program. If you want to find out more about this program, click the link below this video. Lisa was able to cure and prevent all future hemorrhoids in less than 2 weeks after she followed this proven 5-step system, so can you. Click the link below and start now.